just to go over a few things on how we serve the community, more so the assisted living community, whether that's independent living, whether that's rehab, right? Meeting you where you are. I am Kiva from Premier Home Care Residential Service Agency that was launched in October of 2025 in honor of my grandmother Nana, who passed away October 1st. We were actually licensed on my birthday, which is October 24th. So this agency is very near and dear due to our life experience with my grandmother. So I was her caregiver for about 3 or so years before I even knew what caregiver the role really was, right? Or what I even knew what home care was, non-medical. So basically, my grandmother, she received home health, right? Home health care, which is required to have a doctor's order in order to be able to get that approved through your insurance. She had Medicare, so she had limited resources. She wasn't eligible for certain, state or county programs. So she was participating with that, and so we were able to get her hospital bed, her what did she get? She got her BiPAP machine, she got her blood pressure cuff, she got her portable commode, she got a lot of different things, hospital bed, wheelchair, like all the things. And so it was a process to even get free equipment from the county as well. So if you're in Maryland, well, I know Maryland, we're licensed in Maryland. There are opportunities for you to get free equipment. I'm not sure, remember if you need to go get your doctor to sign off on it, but I'm gonna find the link. I'm gonna put it down below so you'll be able to, find that, okay? So then we have non-medical home care, which our agency is all about. Thanks to my grandma Nana, we provide non-medical home care, and that looks like it could be assisting your loved one after a surgery, assisting your loved one after rehab, right? It could be assisting in any way in order for you or your loved one to remain home and be independent, okay? So that may look like medication reminders. It could be transportation to your appointments, like we did for my grandmother when I wasn't able to be physically there. We hired an agency to do that for us, and they were able to call me on the phone so I can be present virtually and or telephone to support that doctor's visit for my grandmother. So those are some of the ways we're able to support light housekeeping, like organization and so forth. So that's how we're able to be a resource, right, to the community. But I'm more so speaking today to my partners, right? Assisted living facilities, it could be independent living, it could be rehab. So I'm calling all caseworkers, discharge planners, right, to speak to you and even speak to the admissions coordinator as well, right? So we are in the business to partnering with the community, and I'm going to go over our mission. So basically, our mission is to be a trusted source, because from my experience, I'm using all my personal experience from my grandmother, right, to incorporate to be our agency to be top level customer service, right? So that means following the care plan, right? And making sure you have reliable team members. So we're all about that. But in regards to assisted living facilities, independent living, our mission is to be a trusted source that provides residents care through supplemental companion care. So we are willing or able to work in those settings as supplemental companion care, right? And what that means is like helping with social engagement, activities, reminders, different activities like that. So being a support to the assisted living facility, right? Delivering that one-on-one companion care, because there are some residents who may need additional support outside what the company or facility can offer at the time, right? And so we work alongside the facility to accomplish one mission, and that is to keep to provide companion care for the residents, right? And also we maintain transparency, right? Effective communication, open communication, because without that, there's nothing, right? We have to be collaborative, and we have to be able to be transparent in communication to work alongside the facility, whether it's assisted living, independent living, rehab, or even in your home, right? So basically, I already shared the story about my grandmother. Like I said before, she passed away first. Our agency was licensed on my birthday, October 24th, 2025. Let's go. Let me know in the chat where you're checking in from. And if you, in fact, are looking for home care for your loved one in the state of Maryland, and if you have any challenges, what do they look like? And I'll be sure to respond when I can in order in which they are received, okay? So I do believe that this is a very near and dear part of my journey, right? Being able to use my experience to impact the community, to serve other residents, other clients who may be looking for the same care that we did, right? It allowed my grandma to be able to be home. And I believe she lived longer because she was happy, right? And she stayed out of the hospital. So our goal is to keep your loved one out of the hospital and to collaborate and to work with the family and the facility if they are actually in assisted living or independent living or memory care or whatever it may look like. So I'm really big on that. So we're using our pain for purpose, as Kathleen Cameron would say. All right, so how we serve the community, right? So I mentioned before that we serve whether you're in-home, assisted living, independent living, memory care, rehab, all those things. But we serve by one, following that care plan, right? So, and the facility procedures. So we work together, we collaborate, right? And also like I said, open communication is so important and so big for this line of work. And providing one-on-one support to the resident, right? To have that extra support because there are some residents who may need more support, right? And again, working alongside the staff is so huge and really, really so important. We have community outreach. So we are volunteer, and we are actually going to host our monthly walk club for active older adults, really just all adults, just to get out, to move our bodies so that we can, maintain a level of, healthy, active lifestyle, right? And even if you aren't able to walk, right, just doing something. So we'll be out there having other activities. If you're not able to walk with us, no problem. And so now I want to ask the question to my assisted living facilities, to my independent memory loss, rehab, to all those partners, right? And then comment down below in the comment section. Question number one is, how do you currently support your residents who need extra one-on-one supplemental companion care? Just let me know, what does that look like for you? And then also, what is your process for partnering, right? I had one facility, it was quite interesting. They responded back in an email and was like, we do not need support, and nor do we need support in the future. I was like, really? How are you able to project the future? We don't know the future. But that was okay. That wasn't the right partner, right? And that's okay. We're in this line of business to be to serve, and everyone is not the ideal partner, and that is okay. But there are some who are a perfect match. Okay. So, anyways, again, put in the comments down below. Answer these questions how do you currently support your residents who may need additional support? All right. And then for supplemental companion care, and I mentioned before, supplemental could just be meaning extra support with social engagement, engagement with reminders, medication reminders, or just whatever that may look like to support the residents while they're there in your facility. All right. And so that's it for today's talk. I just wanted to reach out to all my, nursing directors, directors of memory care, assisted living, independent living, all the above, my partners, that we are really here to serve you, serve the clients, resident, and support you to provide supplemental companion care. We are licensed right here in Maryland. We serve Prince George's County, Howard County, Anne Arundel County, some parts of Montgomery, and other surrounding communities as well. So if you're in the area and looking for support, comment the word ready down below, and I'll be able to provide you a link. But that is it for now. I'm going to get out to go get my son because this is home care as well, non-medical. He tore his ACL and both meniscus and one of his knees. I can't remember. So he had reconstruction surgery to his knee, and so he needs support, to his appointments, getting back home and so forth. So this isn't for only seniors. It could be for adults. It could be for children, right? It could be for whatever you need it to be in order for your loved one to remain home. We just really specialize in seniors and adults too because of my son. So, all right, that's it for now. Have an amazing day. Don't forget, let me know where you're checking in from. Let's go.